Yeah, thank you. Okay. So, hello everyone, and welcome to today's session in our Respiratory Matters webinar series. And thank you for taking the time to join us. For those of you I haven't met before, I'm Andrea Pace, the Assistant Manager for the National Clinical Strategic Network for Respiratory Conditions. It's always great to see such strong interest in these sessions, and I'm really pleased we've been able to create this space where colleagues from across the system can come together, share ideas, explore best practice, and learn from one another. These webinars are all about the connection and conversation and shining a light on the brilliant work that's happening across respiratory care within Wales and further afield. Each month we focus on a different topic that's relevant to improving respiratory service, whether that's service transformation, data insights, innovation, or clinical practice. We know how busy everyone is, so we really want to make sure that what we cover here is practical, relevant, and worth your time. So before we get started, just a few quick housekeeping points to help with the session run as smoothly as possible. First, we kindly ask that you keep your microphone muted and your camera turned off for the duration of the session, because this helps with sound quality and minimises any distractions. The webinar is being recorded, and the recording will be shared afterwards via the Respiratory Network website and the Respiratory Matters Teams channel. So if you have colleagues who could not attend today, please share, or if you want to revisit anything later, you'll be able to do so. Just to mention, there might be a delay with uploading the webinar onto the website, but the session will be available on the Respiratory Matters team channel within a few hours, and the link is in the chat. We will have time for questions at the end, and we'll get through as many as we can. If we do not have time to answer everything, we will pull together a written Q&A and share with you. We'll also be adding relevant links and resources into the chat as we go along. So today we are focused on something that underpins so much of what we do, and that is data. More specifically, we'll be taking a closer look at the National Respiratory Audit Programme, NRAP, and the insights it provides into the quality of the respiratory care across primary and secondary care settings. We are really pleased to be joined by two great speakers from the NRAP team, Jodie Henderson, who is the Project Manager for COPD and Primary Care, and Peter Van Geffen, who is the Deputy Programme Manager for the overall audit programme. As a network, we link in regularly with NRAP to make sure our work is aligned and that we are learning from the data that is available. These audits offer a source of insights to help us reflect on how services are performing and where there are opportunities to improve care. So during today's session, Jodie and Peter will be giving us an overview of the NRAP work streams. They will be sharing the latest findings from their reports and talking about how the data can be used to drive improvement at a local level. They will also touch on participation in the secondary care audit in Wales and how teams can get involved if they are not already. So Jodie and Peter, it's a great pleasure to have you both with us today. Thank you again for making the time to share your work with us, and I'll now hand over to you.
Thank you very much for that lovely introduction, Andrea. I will just share my screen and we will make a start. So, as Andrea's just said, Peter and I are part of the NRAP team, so I will be calling it NRAP moving forward. And we will be, our aim for the meeting today is to provide an overview of the National Respiratory Audit Programme, all the work streams we have within the programme, an overview of the data that is available, including a look at participation, and we will also run through KPI attainments for each of the local health boards within Wales, followed by the Q&A. So NRAP builds on a strong history and experience of respiratory audits, reviews and programmes, including NRAD and NACAP which I'm sure most of you are aware of. We work across 6 work streams, and we hope to use the data collected within NRAP to support clinicians to deliver healthcare improvement, to empower people living with respiratory disease and their carers, and to inform national and local policy. So as you can see on this infographic, we have primary care, secondary care and PR work streams. I'll talk about those in a little more detail shortly. We also have a healthcare improvement programme, which Peter will give an overview near the end of the talk. And as always, PPIA is woven throughout all of the outputs that NRAP produces, as we want to ensure that the patient voice is reflected and central to all of our decision making. A new example of this is our recent Catching Our Breath patient report, which sits alongside the national report. So we really do take the patient voice seriously within NRAP. So moving over to our primary care work stream. So our clinical lead for primary care is Catherine Hickman, and within primary care, we collect data for COPD, adults with asthma, and children and young people with asthma. The data we collect in primary care is aggregated to the LHB level, and this is automatically extracted from GP systems by our data providers, DHCW. The data that we collect there then informs our primary care clinical audit reports. So these are published approximately every 2 years. The last one was published in September of last year, and we are currently working on the next iteration at the moment. So within these primary care clinical audit reports, we will have up to 5 recommendations per report. So these are usually aimed at local health boards in order to make change within the respiratory care. We also have a primary care information portal. So this is something that is managed by DHCW. You can access that through the link which is in the slides, and this allows participating practices to review their individualised patient level, practice level results, so you can really get into the nitty gritty for healthcare improvement. In our last report, we had 95% of GPs within Wales submitting data, which contributed to the recommendations, which is obviously great coverage in Wales. And moving on, these are the current recommendations that are within our primary care report. So as you can see here, we are focusing on early and accurate diagnosis of COPD and asthma, tobacco dependency pathways being embedded within primary care, local health boards increasing training, resources and engagement for referrals to PR, and then looking at personalised asthma action plans, ensuring that these are prioritised and promoted for patient use. And finally, we are promoting the use of preferred SNOMED CT codes as well. So we have a link within the report which shows what SNOMED CT code should be used for respiratory care. On the QR codes at the bottom of the screen, you'll see links to videos from our clinical lead, Catherine Hickman. So she talks through these recommendations and gives some examples of actions people can take for healthcare improvement as well. So we'll move on from the primary care aspect of NRAP, and we'll move over to our secondary care work streams. So as you can see on the infographic, we have adult asthma, children and young people asthma, COPD and PR work streams as well. So COPD is our longest running and largest data set within NRAP. So this started back in February 2017, and our clinical lead is Arem Patel, who's based in London. This then followed the adult asthma audit, which started in November 2018, and then the CYP asthma and PR audits were both launched in 2019. In the first iteration of the PR audit, this focused solely on COPD patients. However, this has been expanded since November 2023 to include a range of respiratory conditions, including asthma, long COVID, and chronic heart failure. I think there are around 8 other conditions as well, and that information can be found on our website. So that was just a quick overview of what we do at NRAP and what our work streams are all about. So I will move on now to talking about the data that is available from NRAP. So for the secondary care and PR work streams, data is input by service users via our web tool. So the web tool can be accessed. We can give the link for that one as well. So it's on a web tool called Crown. So this has created the database of patient admissions. So all of that data is then used and made publicly available via our live run chart and benchmarking tables. So I'll talk about those in a little more detail in a moment. And then that same data is then extracted for national reporting purposes. So we have a whole breadth of reports that NRAP produce, including our State of the Nation reports, primary care, organisational audit reports. So that is looking at how the organisations have run, staffing levels and that sort of thing. And then we have outcomes and outliers. So our outcomes and outliers report will be published in October of this year. And our outliers report is focusing on participation this year. And the purpose of all of these reports is to produce national recommendations and local suggestions for healthcare improvement purposes. All of our data can also be used for research purposes. So we can have third-party data requests. For any of those that come through, they go through a whole process with our research committee, but all of our data that is used within reports is publicly available as well. So this is just to show you a breakdown of where NRAP data is available. So we have live run charts and benchmarking tables, which both sit on our web tool via Crown. So our live run charts show a trend graph of national and service level data for key metrics for each of our work streams. So you can see that broken down by each work stream on the web tool as well. Our benchmarking tables show data at a national, regional, ICB or LHB and service level for each of the key performance indicators for each work streams. So these KPIs are also reported on in our national reports. And Peter is going to give a demonstration of the attainment of the KPIs for the Welsh LHBs in more detail shortly. So alongside the live data, we have the State of the Nation reports, organisational and outcomes reports. And all of the data that sits behind those are available in the data files on the RCP NRAP webpage. And for the secondary care work streams, they also are made available on data.gov. So these are just examples of our current secondary care reports. So as I said earlier, Catching Our Breath was published in June this year. So this one is hot off the press. And then our organisational audit was published in November last year as well. So these slides, these images both have the links to the report, which will be available to you after the meeting. So I thought it'd be great just to give you an example of what the recommendations look like within the Catching Our Breath report. So this was published last month. The data report, report has data collected from the 1st of April 2023 up until the 31st of March 2024. And as you can see, within each of the recommendations, they are all grounded in the data that we have collected. So for example, recommendation number 1 is around participation within the audit. So we're hoping to increase both participation and case ascertainment throughout England and Wales. And you can see from the data there that we need to increase those numbers. For ensuring timely access to optimal care, we have a recommendation there that the British Thoracic Society should lead on the development of an acute care bundle for patients with asthma and COPD, again, with the data sitting behind that. So for any recommendations within any of the reports that we publish, you will always see the data that sits behind those. And if you ever have any questions about the data sitting behind any recommendations, please get in touch with us. And then finally, this is just to show you what the data.gov website looks like. So if you put in the search bar NRAP, you will see all of the reports associated with us. Again, this is just for our State of the Nation, organisational and outcomes reports. The primary care data file will not be on this. It's on the RCP NRAP page, as only English data needs to sit behind this. But obviously, the Welsh data will appear there as well for the secondary care work stream. And then at this point, I'm going to move over to Peter, and he'll give you an update on participation within Wales.
Thanks, Jodie. Good afternoon, everyone. Hi, my name is Peter Van Geffen. I'm Deputy Programme Manager for NRAP. I'll be talking through a number of slides, particularly around the data that sits behind all of the local health boards within Wales. The first slide that you can see is outlining the current participation and non-participation within Wales. And it's broken down into two columns. It's for the data for 24-25, which has just been extracted to provide the informed data for the next iteration of our State of the Nation report, which will be published in June next year. And then the 23-24 data and non-participation, which has been singled out as outlier reporting. So we will be escalating those to Welsh Government that didn't participate in the current just published Catching Our Breath State of the Nation report. And the broken down into each of the different work streams as well. So you've seen that NRAP are committed to ensuring that the data that is provided is available in as real time as possible. So it's very accessible for services to access their data. It's updated hourly for the benchmarking tables. So virtually data goes in, you will be able to see the amendments that has been made or the changes to the data outputs in real time virtually. But we are aware that data burden is a very real thing, you know, with regards to taking the time to enter the data into the audit. Does take a lot of time and effort and manpower, which isn't readily available. So this is very much acknowledged, and we're working with HQIP, the Healthcare Quality Improvement Partnership, in developing policy and processes about data burden reduction. So again, we will be following that up with potentially methodology with regards to electronic linking with electronic patient records. It's in the infancy at this moment in time. But what we wanted to say to you is that your data is the golden egg. It is the thing that is really what makes worthwhile the time that and commitment of putting that data into the audit. And that's why participation is key. Because if you are participating, you do have access to your data in real time, that you can make amendments, make changes, make logs of what the data was before of healthcare improvement change. And then you can actually see the impact of that change in real time, which then can drive healthcare improvement across the services. It's really important. So as I say, the outliers will be shared with Welsh Government at the end of the year. Sorry, actually within September this year. What is concerning is there's been a big drop off with non-participation in COPD, particularly over the course of 24-25. So we'll be reaching out to those services over the course of the next few weeks to understand their particular circumstances with regards to participation. Next slide, please, Jodie. So this is a breakdown of LHB data for each of the work streams. So the first slide we have is the COPD, and it's reporting on the data that's been extracted for 24-25. So these are taken direct from our live run charts. So if I have time at the end, I'll be able to show you the live run charts and how you can access them. So there was a total of 2,978 COPD patients. We report these against the KPIs. These KPIs have been designed by our stakeholders, so a range of stakeholders ranging from services themselves to BTS, to Asthma and Lung UK, to different clinical teams around the country as well. And they were being made in relationship to the national guidance. We've got KPI 1, acute treatment of NIV within 2 hours, oxygen prescribed to a target. KPI 2, spirometry results available, referred for stop smoking support, respiratory review within 24 hours, and discharge bundle. The discharge bundle, KPI 6, is all of the elements of the discharge bundle. So that's particularly revealing to see that all the data there, apart from Huldar, apologies for mispronunciation of any of your local health boards, there as 8.1 in the second bracket. So we are placed into quartiles, so quite visually you can actually quite quickly see the depth of the data and where each of the hospitals and the health boards sit in relation to neighbours, etc., and England and Wales. And the dark orange is quartile 1 for the lowest 25%. Lighter pink is quartile 2 for the next 25. Light green is for the third 25%, and dark green is for the top performing 25%. So we can see that oxygen prescribed to a target range is best performing KPI for COPD. And again, this data is, as I say, when the data goes in, the data changes readily and in real time within an hour. So therefore, you'll be able to see any changes and implementations of any healthcare improvement that you put in place. Next slide, please, Jodie. So again, the slide shows adult asthma for 24-25 from 1st of April 24 to 31st of March 25. It's been recently extracted and will form the State of the Nation report for next year. We've got KPI 1, respiratory review within 24 hours, peak flow within 1 hour, systemic steroids within 1 hour, key elements of good practice at discharge, tobacco dependency addressed, inhaled steroids at discharge. So we can quite quickly see, again, across the board that where local health boards are performing well in relation to England and Wales, and where they are performing not so well in England and Wales. And again, KPI 2, peak flow within 1 hour, is the best performing KPI out of the adult asthma. And again, at the end of this, you'll be given an opportunity to ask any questions, and we'll be able to hopefully answer those questions for you. Next slide, please. Children and young people asthma for 24 and 25. So their KPIs are steroids administered within 1 hour, tobacco dependency addressed, parent carer tobacco dependency addressed, inhaler technique checked, and personalised asthma action plan on discharge checked. You'll notice that KPI 2 has no correlation to the actual benchmark. That is the reason is that only 44% of children across England and Wales are even asked the question whether or not they are a current smoker. That is for 11 plus children, and we've got reports in there. So we've got 2 CUMTAF performing at 100%, which is really outstanding for this KPI. So we removed the coloration there because we had significant numbers of services that were not asking the question. So the new iteration of the run chart that will be available is actually going to show a trend on the actual amount of patients within a service that have actually been asked the question. So not recorded is not going to be able to be an option. It's actually going to be have to be answered. Did they ask the question no or yes? And not recorded will not be available. Parent and carer tobacco dependency addressed is slightly better, but only 56% of patients across England and Wales get asked the question as well. So again, the data has a lot of not recorded within there. And you can see Cardiff and Vale University LHB didn't participate at all within the 24-25, so therefore they have no data to compare or benchmark themselves to within the other LHBs. Next slide, please. And our pulmonary rehabilitation, looking at the data from 24 and 25, there were 1,145 patients who accessed PR, and we have KPI 1, COPD start date within 90 days, practice exercise walk test, completion, discharge exercise plan, 1 walking test MCID achieved, and health questionnaire MCID achieved. And we've got a bit of data, really good data in each of the KPIs here. So what we would be recommending is actually sharing knowledge across LHBs as to how your LHB was successfully achieving KPI 3 for completion for neurobevan. And you may be able to gain an insight into the processes and practices that are going on within that LHB, and hopefully that will be able to be transferable over across to another region, another LHB. And again, out of all the 6 KPIs, there's only KPI 4 where you haven't got an LHB that isn't in the top 25% performing LHBs. And again, we've got powers teaching at LHB, again, with no non-participation in there. And Jodie, next slide, please. So in 2024, we started our healthcare improvement programme, and we've got 10 coaches now across England and Wales who are working with NRAP, our healthcare improvement clinical lead, Alice Turner from Birmingham Universities, and they've been working on their own projects within their own hospitals to actually drive healthcare improvements against one of our key healthcare improvement goals from 24 to 26. These good practice repositories are being rolled out with 26 teams across. So these coaches are supporting 26 teams, and they are going to then be sharing their good practice repositories of how they implemented that change and the data before and the data after. And these will be available towards the end of this year, October, we are hoping, which we will then be able to share with all of our networks to enable services to see a KPI potentially where we're underperforming against, and to then see the processes and understand whether or not that's tangible and manageable to implement within an LHB within Wales. And these are our key core goals for 24-26. So we've got prevention. 80% of patients with COPD and asthma who smoke, and patients with COPD who smoke have been offered a referral to treat tobacco dependency and or prescribed treatment. We've got delivering earlier accurate diagnosis. 70% of patients with COPD have a quality assured post-bronchodilator spirometry, which confirms obstruction, and 70% of people diagnosed with asthma in the past 2 years have ever recorded record of an objective measurement. We have supporting self-management, so 75% of patients with asthma and COPD discharged from hospital, as well as patients in primary care with a recorded diagnosis, have a current self-management plan. And then timely access to optimal care. 70% of patients start a PR program within 90 days of referral. 70% of patients with an exacerbation of COPD start within 30 days of referral. And 80% of people with COPD and asthma have their inhaler technique checked after admission and annually within primary care. Next slide, Jodie. So this isn't also an offer today. You know, there are many ways that NRAP can support. We have been reaching out and we've been meeting regularly with ICSs in England, and that offer is there for Wales as well. So please do drop us an email and we will come with specifics of individualized hospital services for your LHB, and we can talk through that data in greater depth and participation and case ascertainment, and you hopefully get a greater and deeper understanding. So we have several ways that we can support as well. On the web tool for secondary care and PR, there are help notes throughout the data set. We have also a download section which hold the data sets and data collection sheets. We're happy also to meet to discuss your data in more detail with an operational team or a workstream team. And DHCW can provide technical support for the primary care information portal. And our contact details here are NRAP inbox at rcp.ac.uk, and there's a telephone number as well, and that is staffed from 9 o'clock in the morning till 5 o'clock on weekdays. There's a core team that sit behind there who answer those calls, and please don't hold on to any queries. Please do drop a line or give us a call quite quickly, because we can actually get you participating and actively engaged in the audit very quickly and swiftly. I'm not sure I understand. And I just wanted to quickly share my screen, Jodie, if that's all right, just to show these benchmark tables and how they actually So I am going to just bring this over here. So if you visit nrap.org.uk, this is the public-facing arm of our web tool, and here you can see each of the work streams that we've been talking through today, and you can see the COPD care visit reports, which takes you through to all of the current and historic reports. You can see charts and benchmarks and patients. If I click onto charts and benchmark, you will be able to see the live run charts down the side, left-hand side, best practice, oxygen, smoking 23, spirometry, and vaping. And these are in time order, and it shows a different range of metrics. So this one is about BPT, and care meets the BPT. And you can see the lines for the respiratory review percentage, respiratory review within 24 hours, and whether or not the discharge bundle was completed. You can actually zoom in onto a section as well by dragging across time, so you can quite quickly see where you've implemented a change to a team or a process, and you'll be able to see hopefully a step change, an improving step change within the charts. You can click onto a line as well if it's a bit too noisy, so you can actually remove and improve the view that you are incorporating. The benchmark is literally on the left hand side as well, so if you click onto benchmark, brings up the benchmark table currently for 24-25, and we are about to launch for COPD a new benchmark where you'll be able to click on Wales and only see the Wales hospitals that sit underneath that as well. That is imminent launch as well, so I'll keep referring back to this. If you click on show 10, you can all, and you'll see all of the hospitals' performance in the benchmarking against those 4 quartiles for each of the different KPIs. And again, this is a tool to know. You may have colleagues within different hospitals who are performing really well with KPIs. It's a tool for you to actually go and see that and actually use those your networks to try to understand the processes of good practice and bringing that back into your own service to drive healthcare improvements. And you can click on a KPI and it quickly sorts the KPI into 25% brackets for each of the performance. And yeah, and you can search for a hospital. I will not name any. Oh, that's my local hospital. So I put that on the Wirral, and so yeah, you can quite quickly search all of the hospitals within there. I just thought that was worthwhile sharing. I think just quickly bring us back to, yeah. Thank you.
Thank you so much, both, for that really informative and engaging presentation. It's always encouraging to see how much thought and collaboration is going into understanding and improving the care we provide through data. We're now going to open the floor for questions. So if you have a question, please put your hand up, and any questions put in the chat. We'll do our best to respond to as many as we can in the time we have left. Just a reminder that if we don't get to your question today, we will circulate a Q&A summary after the session. So anybody have any questions, or will we go in the chat? Christine or Officer, are you moderating? Do you want to give us a few questions from the chat?
We have one question in the chat asking if you can help with how can you help primary care? That was the question.
Would I ask for a little more detail on that question, please? So at the minute in primary care, we make recommendations within the clinical audit report. We report these to Welsh Government as well, and the primary care information pool is also there for practices to look at their practice level data so that they can make healthcare improvements there as well. But if I could have a little more detail on that, that'd be great.
Yes. I believe the person is there. Would you be able to expand, please? Thank you.
Yes, hi, I'm Dr. Ekweme. I'm Primary Care Medical Director in the east of Betsy, and we've tried to have a look at this on behalf of our managed practices because they are the ones obliged to participate. My colleague who's also on the meeting did most of the work, and we've got data. But what we're struggling with is in terms of how to complete the report in a meaningful way, how to make the data make sense, how to make recommendations out of it. We did get some feedback from our RO, but we are struggling. So even if it's just someone that could just join us for a quick, I don't know, 10, 15 minutes Teams meeting at some point, and we can just go through it and show them where we're struggling to see if there's anything, because we don't know what we don't know. So I really don't know how to express exactly what I need. We're just kind of lost, and we just need someone to sort of help us tie it together to make it into a sensible thing. I have emailed now the email address you put on the web chat, on the chat.
Great. That'll be picked up by the team, and then we'll get in touch, and where we can set up a meeting to discuss in further detail, we'll do that.
Thank you.
Thank you for your question. Next one, we have Natalie James asking, have you had any feedback to why health boards haven't participated in certain areas?
So yes, we have. We have communicated with all of the local clinical teams at each of the hospitals, and they were given an opportunity to respond to that, making them aware of the outlier reporting process. And then we've actually gone to the local health board level as well and made sure that they have been communicated. And we've got a range of different feedback. A lot of the feedback is around staffing power as well, on the floor, which is where we're really driven to actually show you what you have available from taking that time to enter the data into the audit. So yeah, we have got a range of different feedback from those, and again, the outliers and outcomes report is due for publication in October this year. Again, you'll be able to find out a little bit more from that by reading that report when that comes out. And just on that, the outliers report, the outcomes report is due for publication in October, and it reports on readmissions and mortality at 90 and 30 days post discharge for adult asthma, CYP asthma, and COPD as well. So that's one that's coming right around the corner.
Thank you. There was a question from Stacey and then Sean next. Stacey, would you like to just give us your question? I saw your hand raised earlier.
Yeah, I think it was just to expand on what Bisola was saying. So we've done the data collection and we've looked at the recommendations. I suppose we just need support on how to implement some improvement in our workplace to meet the targets, I suppose. So it'd be quite insightful to what other health boards have done as well to meet the targets, if possible.
Yeah, I think if we can take that offline and we'll have a specific call around that. That sounds great.
Thank you.
Sean, you had your hand raised.
Hi everybody, I'm Sean Evans, Public Health Wales. I'm interested in two elements of this, and I've listened to NRAP present before and I still can't get my head around it. So the first thing is the easy bit, I think. You talked quite a lot about a State of the Nation report. Is that split? Is it UK or is it a Wales specific? Will there be, so that's my first question. Is that an easy one to answer?
Yeah, it is. So that's a combined report. So that's data from England and Wales. So you will have Welsh data within those data files for that report.
So my follow-up question with that then is, are you aware of the State of the Nation report that's already been published recently by Public Health Wales? Because hopefully the data and the themes that come through will be similar, because if they're not, somebody's data set isn't right. So that's something you might need to be aware of. It's available, and I'll try and find the link while we're on the call. It's not been written by me, it's been written by a whole group of people, and the network had a chance to feed into that as well. So I don't know whether you're familiar with that, but that's something that you might need to be aware of. And my second question is, so the data you're talking about is all collected in secondary care, the majority of it. I know there's some primary care projects. So if somebody suffers those conditions but don't present in secondary care, they're not caught up in any of this data then? No.
No, they have to be admitted into a hospital within Wales to be incorporated in. So there's a very tight inclusion criteria for each of the patients that gets admitted into the audit.
Okay, so the audit is the care within a hospital setting primarily, although some of the performance KPIs look like they then breach into primary care, where they've got things like follow-up 90 days, inhaler techniques, all those things. How do you kind of sort the interface out when you're only collecting one little bit of the data?
Every single thing that we collect is should be completed by the hospital team, the respiratory team within the hospital. So the discharge bundle should have an inhaler technique before they're discharged, a personalised asthma action plan, etc. before discharge, and the follow-up is a referral made. So does that get made? Whether or not that is an attendance to that, then that can't be charted from the audit. But it is whether or not the respiratory team have taken the good time to actually follow the evidence of making sure that the follow-up has been put in place, and then that reduces outcomes, mortality and readmissions as well, by ensuring that they are obviously followed through, but making sure that they're there in the first place is what we're collecting.
Okay, thank you.
I think we may have time for one more question, Christina, before we
Sorry,
start
my microphone
closing.
froze. I said freeze and it just froze. There's a question from Tom Lines. Do we know if Wales will adopt an outpatient consenting process for the PR audit, like in England? Consent for participation in the audit has been a big problem in Cardiff and Vale.
I think it's opt out, maybe.
Oh, opt out.
Yeah.
Opt out consenting process.
So there's a section 251 in place for the PR audit now to collect data without consent. And then obviously in Wales, it's very different to apply an opt-out. They have to do it on an individual site or service basis, where they have to explicitly say that they want their data to be opted out of the audit. So Tom, if you drop me an email, please, at NRAP inbox, I will follow that up with just the process. And then hopefully if it is something that you think should be shared across Wales, then I'm more than happy to share that through the Respiratory Matters team as well. Okay.
Oh, thank you. I just want to add there in the end that Anthony Davis has confirmed that, Peter, you're talking about the secondary care audit reports in the programme, where there is also a primary care module with just Welsh GP data. So I just wanted to clarify that. Thank you. So before we finish, I just want to say thank you to Jodie and Peter for joining us today and for sharing such a valuable insight into the work of the audit programme. I would also like to say a big thank you to Christina and Faseko for the respiratory team for all their hard work they do behind the scenes to ensure each webinar runs smoothly and is a success. Thank you so much, both of you. And a thank you to all of you for joining and contributing to the discussion. These sessions only work because of the people who take part, so we do really appreciate your time and engagement. So just a couple of final reminders. The session has been recorded and will be available on the Respiratory Matters Teams channel shortly. There may be a slight delay of uploading to our website, but you can find the link in the chat to access it on Teams. We're taking a short break in August, but the Respiratory Matters series will be back in September. And our registration process has changed because our audience continues to grow. So we've moved away from using the Outlook calendar invites. So you'll now receive a registration link via email, and this will be available on the news section of our website. We'll share more details about our next session nearer the time, but we do hope you will join us again in September. So until then, have a good summer, and thank you again for attending and being part of today's session. Goodbye.